I guess I wanted to just dive into this because, with the Commission Corps, it's saying as a Commission Corps officer of the U.S. Public Health Services, keeping professional licensure and certification up to date is mandatory. So I guess I just wanted to get a sense of how you're squaring this here.
Well, I do have a medical license right now. It is voluntarily placed on inactive status because I'm not actively seeing patients at this time. The HHS and Admiral Brian Christine have testified in front of this committee that I am eligible to serve as the medical director of the HHS.
But how does that square with saying here it says keeping a professional licensure and certification up to date is mandatory? Is yours up to date?
I have an active I have a medical license that is unexpired right now. Admiral Christine has testified that I'm eligible to serve in this role. I'm the president's nominee for Surgeon General, and further questions about that will have to go to
So if we were to expand that, would you say that, like, with the others in the Commission Corps, do you think we should remove the mandatory licensure for them to be able to participate in the Corps?
That's not a question that I've considered. I don't think it's actually relevant to this particular hearing.
Well, it's relevant insofar as I'm just trying to think through, if you're in this job, how are you going to be proceeding, and what kind of advice you're going to be able to give to the American people and the credibility that they will have in understanding what your advice is. Also, in terms of, if you are a leader of the Commission Corps, I'm trying to get a sense, are you going to deprioritize having an active license in the same way that you believe that you can do the job of a Surgeon General without having an active license? Do you believe that that is the case for others in the Commission Corps, that they can do their job without having an active license?
Senator Kim, I'm a medical doctor. I graduated from Stanford University School of Medicine. I have a medical license. My professional history is a feature. It's not a bug. I have had a unique history that has merged entrepreneurship, public health advocacy, faculty, course direction at Stanford University, as well as being an editor of a medical journal and a biomedical researcher. And in these complex times for American healthcare, that type of multidisciplinary history is going to be extremely valuable for the American people.
I don't discount your accomplishments and your education, but what I'm trying to get a sense of here is your ability to be able to engage with our current medical professionals, to show respect to...
I practiced medicine. I owned my own medical practice, and I've seen thousands of patients, and I did over 4 years of surgical training, which is more than many of our past Surgeon Generals completed who did medical specialties. I have completed extremely thorough medical training, and I have the ability through these experiences to communicate excellent public health information, and I really look forward to working with the Commission Corps. This is an incredible group of people, 5,000 uniformed officers who are committing their lives to helping the American people. And personally, just to share a little bit of
I agree with that. I just want to say the signal that is being sent is one that I think we have to look at. And with that, I'll yield back.